Hi, welcome to my today's class. In this today's class, I will discuss about pressure rupture of esophagus, sudden rupture of esophagus. This is known as Borhaeves syndrome. Now, in this Borhaeves syndrome, there is sudden rupture of esophageal wall through and through tear is there, and this is because of sudden increase in pressure inside esophagus. Intraesophageal pressure suddenly increases. Because of this, there is rupture of esophagus. Now, this particular Borhaeves syndrome is not so common, but when it occurs, it is a dreadful condition. Borhaeves syndrome, that is sudden tear in wall of esophagus, is because of forceful vomitings. And these forceful vomitings are seen in alcoholics after binge drinking. Because of binge drinking, there is sudden increase in pressure in esophagus, severe vomitings are there, and there is rupture in wall of esophagus. As a result of this rupture, the acid will leak in the mediastinum, food contents will leak in the mediastinum, air will enter the mediastinum, and this will produce a mediastinal syndrome, severe mediastinitis, pneumomediastinitis. Later on, after few hours, pleural effusion will develop. So this condition is an emergency and it should be dealt with immediately. Now these patients of Borhaeves syndrome, they usually present with vomitings, and after severe bout of vomitings, patient will start complaining of chest pain. And together with chest pain, sometimes there is severe abdominal pain which simulates that of acute pancreatitis. Apart from this severe chest pain, patient will become breathless. There is difficulty in swallowing. Swallowing is also painful. That means there is odynophagia. On physical examination in these patients, nothing special you will get. You will just get features of pleural effusion. On examination of abdomen, there is tenderness in epigastrium. Patient may go in shock because of compromisation of cardiac functions. There is severe mediastinitis. This severe mediastinitis may produce pressure over the vertebral column posteriorly and may produce severe pain in back. So these patients of Borhaeves syndrome, whenever they present, this is the emergency. So in these cases, immediately they should be investigated. In investigations, first thing is X-ray chest. In X-ray chest, you will get pneumomediastinum plus pleural effusion. Immediate CT scan is diagnostic. In cases of this pleural effusion, if you tap the pleural effusion for analysis, in that amylase level is increased. This amylase is salivary amylase. So if salivary amylase is increased in pleural effusion, that means there is rupture of esophagus. So whenever there is a Borhaeves syndrome, immediately the patient must be shifted to ICU and should be treated symptomatically. So as this tear is compromising the cardiac function, surgical intervention is must in these cases. The only thing which you will have to differentiate from it is acute coronary syndrome and acute pancreatitis. In acute coronary syndrome, you will get ECG changes, enzymes, troponin I that is elevated, which is not seen in these cases of Borhaeves syndrome. Apart from this, CT scan is diagnostic. So ultimately, the treatment is symptomatic plus urgent surgical treatment. These two are the treatments of this Borhaeves syndrome. Thank you.